Okay, we're on the final session. And this is a call to action, not just theory, taking action, discussion, and report out. But it gives me honor to welcome Leona Richards Bishop as a facilitator for our next session to lead us in an engaging discussion focused on translating theory into action. Leona is a licensed professional counselor and owner of Count It All Joy Counseling Service with over 25 years of experience in mental health. She specializes in helping individuals find joy through internal family systems and eye movement desensitization and reprocessing. Leona is a certified IFS-informed EMDR consultant and holds degrees from Tougaloo College and Delta State University. Leona has served as past president of the Capital Area Counseling Association and is active in community service organizations. She received the Mississippi Counseling Association's Counselor of the Year Award in 2022. Please join me in welcoming Leona.
All right, we have reached the part of our day when everyone has an opportunity to participate. Now, my name is Leona Bishop, and you know when you say Bishop and you say everyone is part of the service where everyone has an opportunity to participate, you know what time it is, right? Pastor friend, what is it? Time for an offering. But rather than taking an offering today, what we do want to do is give you all an opportunity to participate. You are the experts. But before we get there, I know the gentleman, when he introduced me, said I was an internal family systems informed therapist. So you know I got to go inside with y'all, right? I got to go inside to get you connected to what we're about to do, okay? What is your body saying right now? Do you need to breathe? Do you need to stand up? It's cold. Can we adjust the air? They're cold. We're going to adjust the air for the last little hour of this time. But we're going to key up some music, and I'm going to invite you all to just kind of go in with me for a moment. So if it's okay with you, begin by just closing your eyes. As we come to the close of this powerful ACEs symposium, we've learned so many truths about addiction, substance use, and suicide. But at this moment, I just want you to take a pause. I want you to honor the parts of you that have been stirred up. I want you to find a comfortable place. Just adjust yourself in your seat. Let your body feel supported by the chair beneath you. And then take a slow, deep breath in. And then take a long, gentle breath out. Just to let yourself arrive here. Not just in this moment, but fully just be connected with yourself. This meditation is just an invitation to acknowledge the parts of you that have shown up today. We want to honor the parts that stayed open. We want to witness the ones that have been activated. And we want to listen to those that now feel called to make a difference. Let's take 3 deep breaths now. And let's begin by noticing the part of you that stayed focused throughout this symposium. The part of you that took notes. The parts of you that listened deeply, that nodded in agreement. The parts of you that sat still even when the content felt heavy. This part may feel calm and determined, or perhaps even a little weary, but it stayed. I want you to offer gratitude to this part by saying to yourself, thank you for showing up. Thank you. Thank you for staying present. Now gently bring your awareness to any parts of you that were activated today. The ones that may have felt saddened, discomfort, and maybe even overwhelmed. Maybe they were reminded of someone that you love, or they held a memory, a worry, or a personal truth. Can we just let those parts know, hey, I see you. I honor your voice. I would not turn away from your pain. If it feels safe, I want you to place your hand over your heart now. And I want you to breathe into that space, just allowing compassion to flow toward those tender, protective, or reactive parts of you. See, they showed up with a purpose. They showed up to protect you, to warn you, or to just remind you to process. So we can thank those parts too. And now listen inward. Is there a part of you that feels stirred to do something? A part of you that feels like it needs to be a resource or a guide or a comforter? Maybe it says, man, this work matters. Maybe it's whispering to you, you can help. This part may carry courage or fear or hope. Whatever it's carrying, I want you to welcome it. Let it speak to you right now in this stillness that you're experiencing. What is this part asking? What action does it long for you to take? Let this moment be a sacred turning point for you. Not a place of pressure, but more like a calling. What's beautiful is we don't have to do it all, but we can do something. So you can listen, you can speak, you can support. You know, you might be able to change one system, one policy. You might be able to change one heart, maybe even a soul. But I want you to breathe into the possibility of the impact that you can make. Breathe into that quiet bravery that it's going to take to answer the call. As we begin to close, I want you to thank all of your parts, the focused ones, the activated ones, the inspired ones. Each part matters. Each and every one of us has something that we can offer. I want you to take one final inhale. And I want you just to say, I honor my truth. And as you exhale, I want you to say, I will answer the call. And when you feel ready, you can begin to open your eyes and return back into this space, hopefully feeling more energized and more motivated to answer the call. Thank you. How are we? I know, right? We're great. But I feel very, very honored to just stand in this space right here with the Glenn Foundation during this ACES Symposium, standing in front of change makers. You, the people that are here that stayed, you're the change makers. I said earlier here with the clergymen, I saw the first responders come in, and I know that I'm sitting in a room filled with helpers. Whether you are a therapist or a medical professional, You are the change makers. You are the ones that, okay, boots on the ground, okay? We've been waiting on that all day. Where your fans at? But you're the ones who are going to put the boots on the ground and be the change makers that we want to see. That's going to really make things happen. We started our morning listening to Dr. Blumenthal, Blumenthal, make sure I say it correctly, where he just inspired us. And one of the things that I remember taking away from him was no change happens without a resource. Guess who are the resources right now? Who? Y'all so quiet. Who? Yeah, we are. Us, the power of us. We had Dr. Taylor who reminded us. I like the question that he asked in terms of the judge. You know, what is the thing you're doing? Is that working? We had Dr. Armstrong, which reminded us that our pain matters. We listened to the panel who basically told us we needed more resources and that we were using a Band-Aid for issues that required a tunica. You know, we've had some very dynamic and powerful speakers today, and each one of them have given us a particular theme or something that we could work with, something we could take with us. Dr. Curry told us we need to go back and get some background. Don't just do the forensics, get more information so we can be helpful. And then Dr. Johnson gave us a lot of statistics, but she also gave us some best practices and things that are going on in our state right now that we can get involved in. So with that being said, at what point today did you hear something that made you think, man, we need to do something? Is it just me? Did anybody else in here hear something that made you think we need to do something? This is a great time to turn and talk to the people at your table. What happened today that made you say, we need to do something? So I just want to hear what kind of things you all came across. Because my job today is to summarize the key themes and insights from across our time together. We're going to highlight real-world action steps and basically empower you to bring these strategies back to your communities. So I'm listening. Anybody, you want to shout out some themes? What themes did you pick up on? Yes, it's an open mic. Okay, is it me? I'm still, okay. So I'll do a couple of themes that I kind of picked up before we got here. But we did listen to somebody who talked about the power of the lived experiences. That was Dr. Curry, who was sharing her story of her grandson. But we also heard about the lived experiences when Dr. Taylor was doing his presentation earlier today. Just helping us understand that we're living these experiences. And are these experiences, when we live these, are they just for me? Are they just for you? When you experience something, is that just for yourself? Why is it that we experience what we go? Why do we go through what we go through? This is the time when we all have an opportunity to participate. So I am listening for you to participate with me. Yeah, I'm listening for those things. What came up?
I think the biggest thing for me today was when we talked about the homelessness and the substance abuse and how we go in and we disrupt their communities and you make their worst days worse.
Worse.
So I never really thought about that until today. So
Thank you.
Yes.
Thank you for sharing. Let's give it up for her bravery. It takes bravery to get in front of this mic and talk. Okay, anybody else? Another one I was going through was to culturally responsive care is essential. One size does not fit everybody. We have to be very cognizant about how we approach care when we're going in trying to help. Because sometimes, the thing about, harm reduction, right? We want to reduce the harm when we're going in and trying to help. Another thing that I was thinking about is, You know, we need to start early. Everybody, the panel, the biggest thing they talked about was having interventions and resources that were addressing and helping our youth, right? Interventions start early. So, any other themes come up for someone else? Okay, don't worry about it. You don't have to talk right now. You just get
I
to
have
talk
one.
later. Oh, okay. Oh, great. Thank you.
One of the biggest things for me that stood out was from Mr. Armstrong's presentation, where he talked about, as organizations, if we want to connect with the community, connect with the spaces where they feel safe already. And they feel like they're connected and seen already, so that we're not just outsiders coming into their space, telling them what we expect from them, but we're connecting with the people they already feel safe with to provide that support.
Good. Thank you. Thank you. Just building on that. Let's give it up for her. I love it. Any other themes? Come on.
Dr. Blutenthal's message of putting people at the center. Oftentimes we think about the problem and we focus on the problem, but the problem is centered around people. And if we start there, that's important.
I like that too. I remember that. Doing that research where it's not about let's go do research on HIV, but let's do it on the people because we're always going to have some problem, right? So focus on the people. Good. Thank you for sharing that. Who else? Is this we got a rally going on? Is this side? Is this side's turn? No one? Okay, come on, ma'am. We're gonna bring you the mic so we can make sure we hear you. Thank you.
From experience, I have learned that it is so important to keep the communication gap open between especially your children, and to carry yourself in a way where one will feel comfortable coming to you for information. But the main thing is make sure you keep that communication gap open and give that person time to finish what they have to say. And you can always do that by just a nod or just a grunt, but make sure that you listen fully to what that person has to say. And I can't say too much. Keep the communication gap open. I love that. The speaker did not say whether it was best or there was a best time to communicate with your children during our lunch or dinner or breakfast, but I take from that, as long as you take the time daily. He said at least 5 days, but I love daily to just hear what they have to say.
Powerful. Thank you, ma'am. Let's give it up for her.
Yeah, I am sitting, but I won't sit down. Yeah, I think one thing that was among many that was compelling to me was Dr. Curry, as she shared her story about her grandchild, how even within nurturing environments, traumatic things can occur that can prove overwhelming to individuals who are still in environments that really aren't nurturing. We never know where people are in terms of what they're able to withstand or shoulder, and that was compelling to me.
And that's one thing we learned about trauma. Trauma does not discriminate and just say, I only hit this neighborhood or this socioeconomic environment. I mean, trauma hits everybody. And it's just a matter of how it impacts, but it affects us all. Thank you. Let's give it up for Dr. Glenn. Everybody gets a hand. Okay, come on.
So I want to say that I'm one of those 60-plus people that many of the speakers talked about. And I'm an old public health social worker as well, who's been around a long time. And the theme today was talking just a whole lot about what's going on with our families, that we really need to try and talk. It's just multiple things we need to do. Talk with our legislators to try to get money in. Because as we look and work with family and have for years, here in Mississippi, the resources are just almost non-existent. I mean, you know, back in the day, you could send some people to Whitfield at the state hospital, and their stays were longer. St. Dominic's had a place, you know, where people could go. That ended up falling apart, you know, just falling apart. So there really are no real places. Back in the day when I was a child investigator for abuse and neglect, we had shelters you could take children to, and you still can take children there. But as the first responders were talking, what shelters do we take people to that they can stay longer than 5 days or 7 days? I mean, and as we look for resources for people, they don't have insurance, or if they have insurance, then there are some organizations that won't take certain insurances
Underinsured.
for our state insurance sometimes. So, you know, it's just multiple things that we need to do. I really did enjoy Mr. Armstrong, and well, I enjoyed everyone, but when he was actually talking about working and training our faith-based leaders, which many people are there, I just see a need for us to try and do more training in the community, because right now we're in a place where we can't really look to government for, you know, that support. And anytime we have any traumas or disasters, the community is always the one to come first. So I think it's incumbent upon all of us to try and see how we can really pool our resources within the community to fill those gaps, whether it's nonprofits, you know, trying to come together to see where perhaps we can have peer people to have talking groups or whatever. Because one of the other things that has occurred to me is that since the pandemic, I have had several of my friends that have children, particularly African American males, that's from 18 to about 40, that have been very, very depressed. I've had two that's committed suicide. And it's like, Kathy, where do we go to get these? Then they call them because, you know, I've been around a long time. Where do we go for services? So because I attend a lot of meetings, I said, well, you want to try this person, or you may want to try that person. But if they don't have their 20-some-year-olds on their insurance, or their 20-some-year-olds are working a part-time job that don't offer any insurance and don't make enough money, what do we do? And these young people now, because of the, you know, after the pandemic, they don't really communicate with each other. They don't have good friends anymore to talk to, or just to vent to. So I just think it's really incumbent upon all of us to try to really work together. As, you know, as you said, we're in this room. We are social workers, we are providers, we are LPCs, we are all those people that are supposed to come together to see what can we do collectively, because we can't do anything by ourselves, but what can we do collectively to really help our community? So that's what I have to say for my old social worker.
Thank you. Thank you so much for sharing. And that is a wonderful segue to go to the next slide, where again, I have one more.
One more.
Okay, well,
That
go right,
Fox
Dr. B.
story resonated with me.
Yes.
And all of the presentations I heard touched on it in a way. Get your facts together before you make decisions.
Yes.
Assumptions will get you in trouble.
Very good. Thank you. Because we do classify people very often, and it's a prejudice, right? We're mistreating people, labeling them. So we need to get the facts straight before we make those assumptions. This is a great time now to go into turning insights into action. So there should be the offering plate at the table. You see it? It looks like this page right here. That's my offering table. This is where you get to give your input. But I'm going to give you about, let's take about 10 minutes for you just to have some table talk time. But I want you to think about what actions are needed or will be helpful. Think about who could lead that. And then if there are any resources or tools or anything that would be helpful. I think on the paper I gave you guys an example of an action step. I'm a retired school counselor, and one of the things that came up to me, and so this was before actually coming to the workshop, of course, but I just kind of thought about how universal screeners would be helpful. And that is exactly what one of our presenters talked about in his research, was saying that there were these youth risk behavior surveys that were given. Youth risk behavior surveys. When I was working in the school system, we call them universal screeners. Just like you test all the students for their, at the beginning of the year, you're assessing their math skills, their reading skills. Well, we also will assess their behavioral risks. But just like, who can lead that? Who's responsible? Of course, school counselors, but it's a district initiative. The principal has to make sure she puts it on the agenda and let the teachers know it's something that they need to follow through to do. But when we got that data, like, what are we doing with that data? So examples of tools that we would have needed would be the assessment or the instrument, but also the time to actually go through and put that in place, right? Now that's me speaking from a school counselor perspective. We have professionals here from various settings, right? Social workers, LPCs, ministers, nurses. So I just want you to think about what kind of resources would be helpful. What kind of action can we take using the information we learned today? What do we want to do? Okay? So let's take about 7-8 minutes. Let's take about 7 or 8 minutes just to talk among your table, and let's just write some things down on the paper. Okay? Do that. How about we have somebody on this side go ahead and come to the mic? You're just going to share out from your table. And then we'll do the volley and come back over here. And then we'll do a volley. See? We'll do that with our time that we have allotted. Okay. Thank you. Let's go.
Okay. The theme is more funding. Without that, we can't survive. We have to go now to nonprofits and foundations. I don't think that we can even depend on the federal government anymore. And what are the needs and resources? Adequate inpatient care, levels of care that are appropriate to diagnosis, comprehensive crisis management, not just dropping them off and not giving them more than just a drop off. And then this is one that's to my heart, that near and dear to my heart, appropriate care for perinatal health. For instance, in postpartum depression, I work in the Delta, and I work with pregnant women who are in crisis or who have a lot of trauma. And they have postpartum depression, and it's only crisis management that takes care of them. And so that's one that that's something I'm going to work on.
Thank you. Thank you. I appreciate that. Let's give it. And so for those of you who have something related to additional funding on your form, let's just consider that it might be, check it off. We know we need additional funding, okay? Any other table want to present? Perhaps someone from this side of the room. Let's not be shy. Oh, we have table numbers? Okay, thank you. Wonderful. There are table numbers. I like it.
It's me again. Me and my table basically talk more, but we do have one
Okay.
great one that we completed. We said that starting ACEs screening in school would be an action step. We could have pediatricians do it outside of school, or counselors, or anybody with a mental health background in school. And we said that it could be like a free screening process that's digital. We mentioned Canvas because they use that a lot in school now. And it just, the need for is just to be, help people be trauma informed, basically. And we also talked about it being like a part of registration, like enrollment. And it kind of put me in the mind of like children having like a chart per se, to help people dealing with the kids be trauma informed. So that was our one that we completed.
Okay, thank you. Thank you. Let's give it up for her. As I was telling another group, I'm a retired school counselor, and to be ACE, to do the ACEs is a good idea, but also consider creating trauma-sensitive schools. So not so much as being informed, because they're not having to actually do practice, but being sensitive. Because I do remember seeing the slide earlier today when I think that was Dr. Curry, when you said the kids are not BAD. Uh-huh. So that was a diagnosis we often gave at the school, on the school level, is that the kids were just BAD. But when I became more trauma sensitive in the approach of what I was using in the schools, I realized it was so many of my students that were impacted by trauma. I mean, when you talk about water, like the officer was talking about, no electricity in the house, and there's no running water, the parents are not there. There's so many things that happen that contribute to the trauma that our kids are facing. Now, I will caution, people who are not trauma sensitive may look at that ACE score and begin to pass judgment on particular children. So we have to be sensitive in our approach and what it is that we're doing when we're seeking to help. We want to make sure we're not causing harm, right? I just want to throw that out there. I think it's a great idea, but I would say make more of a trauma-sensitive approach to schools where educators learn how to look from a different lens when they're working with the children.
That's a good point, because we also talked about how schools target children.
Yeah. Okay, thank you. Somebody on this side. Okay.
Yeah, I just wanted to clarify that when we talk about using the ACEs questionnaire, that's really something that is for an adult to fill out. That's not the kind of thing
Because it's before 18.
that a child can fill out. But then when we look at the score, we have an understanding of what that person has gone through in childhood and how to understand some of what they've been through. And it's actually striking that you say people look at that and then judge someone. What we really are hoping for is that people look at that and have a greater degree of empathy for that person and a greater understanding that we may be dealing with someone who must have their care be trauma-informed care, or else there's essentially no way that we're going to really provide effective care for them.
Thank you for clarifying that. And that's why I was pointing out being sensitive with the information that you're taking in. And he's right about the ACEs, because the questionnaire says before you were 18, did this happen, did that happen? And it's looking at household dysfunction, abuse, and neglect. But it's good, it's better to consider that child, what was it, the risk behavior, the child risk, the behavior risk assessments, using something like that would be your universal screener that you would use to identify your students who need more help.
And I think that's why we were saying if it was a part of the packet when they're enrolling the child, the registration packet that the parent could fill out at a certain, maybe age or certain grade.
Okay, thank you. Thank you. And in the who could help with that, you're going to identify those people as well, right? Okay. All right, anyone else? Yay. Good information is being delivered here.
Good evening.
Good evening.
My table and we work at CPS, and what we discussed was we need more resources in the community, to help our children. This goes beyond the resources, like for the mental health aspect. This also goes like with, sometimes we're in the office countless hours trying to find placement for these children. When they hear, some of the foster parents hear that, oh, they have a mental illness, well, they don't want to take them. And then if we call a facility, sometimes they're telling us they don't want to take these children. So then we're left with possibly finding a hotel, because we would love to take them all home, but that's not possible. So we need more resources on that aspect of where can we place our children who are in need. There is no such thing as a bad child at CPS. These are children who has experienced trauma. These are children who has been abused. These are children who are being neglected. And so we need other communities, hence the legislators and the government can help. If we had, like, you know, somewhere where we could just take all of our children who are we taking into care, that would be so much more beneficial. That gets the workers out of the office all night, because sometimes we're there all night, but nobody sees that part. That's not something that's broadcasted. And then also, we need better treatment for the children so that we can get them the help that they need, and not just saying, oh, after 5 days you got to come get them. That's not helping them. What we're doing, again, is putting a Band-Aid on it when these children really need help. And so that's what I have to say about that from CPS.
Thank you. Yeah, so once again, we hear the need and the cry for resources and places where we can go to for support, places we can go to for that help. Which kind of leads me to this point. And I think you said it when you got up and you spoke just a moment ago. You said, this is where I'm going to start, right? Earlier we did hear another presenter who said, I'm talking to the man in the mirror. Okay, I'm not Michael Jackson, but you get what I'm saying, right? It's time for each one of us to just take a pause and think about, what is it that I can do? I'm going to go back to these social workers that are over here and go back to an experience I had when I was working at an elementary school. And we had this student who came to us from California. And California. And he had been in our school. I didn't realize it. The principal had the behavioral folder in her office that I had not had an opportunity to peruse. I just knew that this kid did have some issues and he had a lot of concerns. One time he was walking down the hallway with our exception ed teacher. He went, and the teacher was like, what's up, man, what's up? He said, dude trying to take that knife at me. We're like, oh, okay. Nobody was in the hallway. Long story. Nobody was in the hallway. Then a couple of days after that, the aunt called and told us that the young man had broken her arm and she was, needing to go to the hospital for her own treatment. This kid is acting out at school. It's coming up toward Christmas, and I am calling to get the bed. Yeah, we need a bed. He's a danger. Come help. But the social worker for our school asked a question. She said, you sure you want him in the hospital during Christmas, Leona? You're like, really? That's what you want? Do I? I mean, he's like a danger. He's seeing things nobody else is seeing. Then the question was, have you written your behavior plan? Huh? Have you put together your behavioral plan for this student? I had not. What was interesting, again, didn't necessarily have to read the young man's folder, but I did work with the teacher, the exception ed teacher. We wrote the behavior plan, and it had interventions. check-in, check-outs, right? Check in with me in the morning, check in with me at night. I mean, at the end of the day, it had behavior modification things that are put in. It was putting this kid with a caring and appropriate adult, right? Making those matches. I used my community volunteers that we had from the city of Jackson. Long story short, no more office visits for that young man from January to, I think he ended up leaving our school, moving back to Chicago, not Chicago, but California around March, April. But he didn't need hospitalization. He did not have behavioral office visits. Why? Because we went in with interventions and we did something different for the young man. So that's the question I'm asking you today, is to think about one concrete action that you could take in the next 30 days to contribute to the prevention or the recovery efforts in the setting that you are. Who's that one kid that you could reach out to, right? I want you to think about what is it that you want to do. And yes, I'm nosy, I want to know, and I want to share this with Dr. Beatty. Rather than you writing it on a piece of paper, I want you to scan the QR code. And when you scan the QR code, you can have an opportunity to put your name, what your role is, whether you are LPC, social worker, whatever your role is. I talk about the power of one. What's the one thing that you're going to commit to do? Who can you tell about this? Because we know when it comes down to a goal, we are more likely to achieve those things that we wrote down, right? I want you to actually see yourself doing whatever it is that you said you wanted to do, because this is where the boots are on the ground. This is where we make a difference, okay? So yes, take out your phone, scan the QR code. What did it say, girl? I got the what? Let me go pull up my computer. That just slows down my whole presentation. Okay, well, just write it down for yourselves. If I can get back to my computer to reactivate this, that'll be great. But for real, what's more important is that you have it for yourself and feel empowered to go out and make a difference. Okay? I'm going to go sit down and see what I can do with this QR code. But thank you all so much for your time. And I hope this was meaningful for you. And Dr. Beatty will be here in just a moment with some wonderful, wonderful, kind, and thankful words.